So, why are you here today? Is Rania sick?
Well, I don't know what is wrong with her. She doesn't seem to listen, and she doesn't understand me when I talk to her. Also, she still isn't talking. I am very worried.
I think I understand. Are you worried that she's not learning as fast as other kids?
Yes, her brother was not like her at this age.
Is Rania using any words?
Yes, she can, mum. When she wants something, she says want, and points to the object with her finger. She also says water.
You told me that Rania doesn't seem to listen to you. Is she turning her head when you call her name?
Sometimes, but it's very rare that she does what I ask her to do.
Does the child have a delay in development? The mother expresses concern about Rania's delay in speech and not following instructions. Recall, by the age of 3, a child should be able to follow simple instructions and make sentences of 2 or 3
Or
words.
that she does what I ask her to do. Very frustrating. Now, I'm going to ask you a few other questions about Rania's capacities. Then we will talk more about her difficulty with speaking and following your instructions. Have you noticed any difficulties in Rania's capacity to move around and use her hands? Is there any difference between her ability and what her brother could do at this age?
No. She likes running and jumping. She also likes to throw objects on the floor. My house is always messy.
Can see that she has good motor skills. She seems very interested in the red toy. She is playing with it quietly. She is exploring it. This is very good. Is she playing with her brother or friends?
No. She spends most of the time by herself, running around or playing with the one toy that she likes. She isn't interested in playing with her brother or other kids.
Is Rania eating by herself?
Yes, but she still uses her hands. She refuses to use the fork and spoon.
Assess developmental skills. Besides communication and speech, what other developmental skills did Senna ask about? Motor skills, movement. Have you noticed any difficulties in Rania's capacity to move around and use her hands? Play and social interaction. Is she playing with her brother or friends? The capacity to do things alone. Is Rania eating by herself? Recall developmental milestones. By the age of 3, a child should be able to walk, run, climb, kick, and jump easily. Use make-believe objects in play. Feed herself or himself.
Do you have any other concerns about her behavior? For example, do you notice any repetitive behaviors such as spinning her body around or moving her fingers repeatedly, or any other repetitive behaviors?
No, I haven't noticed anything like that.
What is Rania doing during the day? Is she staying with you?
I work part-time. Both the kids go to kindergarten in the morning. I pick them up at lunchtime.
It's great that Rania is going to kindergarten. What has Rania's teacher said about her behavior?
She is also worried. She says that Rania is not playing with others' kids. She advised me to bring Rania here.
Rania here. Can I see Rania's health card, please? Rania is growing well. Actually, she's tall for her age. She received all her vaccinations on time. You have been taking good care of her. Is she often sick?
She caught a cold twice this winter, but she recovered quickly.
Do you remember if a hearing test was ever done?
No, I don't remember. Is it important?
I think Rania needs to have a further assessment for her overall development, including hearing.
Assess risk factors for developmental delay. Nutritional deficiencies and other medical conditions. Hearing impairment.
It will be important to arrange a visit with Dr. Kareem. He is a very good specialist. I would like him to see Rania and do a full assessment. Can you go to see Dr. Kareem? He works at the hospital.
Refer all children with developmental delay to a specialist at least once for further assessment.
As you and the teacher have recognized, Rania is having some difficulties with learning how to communicate and interact with others. I can't tell you what the reason is for this difficulty. A problem like this can be caused by many different factors. Dr. Kareem will do additional exams. It is important to make sure that Rania's efforts to learn are well supported both at home and at kindergarten. She can improve a lot, but she needs help. How do you feel about this? I really want her to be better. Can you come back for follow-up every month?
I can ask my mother to take care of my other child. My husband and I are ready to do whatever we can to help solve the problem with Rainier. We have tried our best. We also took her to traditional healer, but that didn't seem to help.
Your husband is also welcome to come whenever he can. We will now discuss practical ways to help Rania learn. I understand that you are very worried about your daughter. I also know that taking care of her can be very demanding for you. Are you okay?
Assess carers' psychosocial needs and provide support.
Yes, I sometimes feel exhausted. But I am fine otherwise.
Can you find time to rest and to visit relatives or friends?
Well, it is difficult to find the time. I work in the morning and do the housekeeping in the afternoon. Also, going out with Rania is very difficult as she doesn't listen to me.
It is important that you find some time for yourself. You are so important for your kids. Is there anyone you could ask to take care of the kids for a few hours a week?
Yes, I could ask my husband or my mother. I never ask for help, but I can try.
To play with Rania?
Continue to assess for risk factors for developmental delay. Poorly stimulating environment.
I try my best to spend time with her as I do with my son. I try to teach her simple games, but she doesn't understand. Sometimes I try to enforce rules. But I just end up frustrated and angry. Sometimes I feel like I'm punishing her, but it doesn't help.
But it doesn't help. It is great that you keep trying to play with Rania. Don't give up. I know it can be very frustrating. We'll start with simple tasks that she can perform. I understand you regarding the punishment, but it is rarely effective. When we want children to change their behavior, positive rewards are actually much more powerful than punishment. When we catch a child doing something well, like imitating our gestures or following simple instructions, this is a great opportunity to say or do something rewarding, such as giving praise. The child is then much more likely to do that positive behavior again. What can you use as a reward? Is there anything that Rania likes?
She likes when I clap my hands.
You can try doing this during the next few weeks whenever she does something well. We will discuss your progress during our next visit.
That's fine. I will tell my husband as well.
I have another question. Has Rania ever lost consciousness for any reason?
No, never.
Do you have any other concerns you would like to discuss?
No, not right now.
Then that's it for today. Just to summarize for us both, we agreed that you will take Rania to Dr. Kareem for an in-depth assessment. You will also keep spending time with Rania and using rewards to encourage positive behaviors. You will also ask your husband or mother to take care of the kids once in a while, so that you can rest and visit relatives or friends. Does that all make sense? If it's all right, I'll schedule another appointment for us on the 6th of June. In the meantime, I would like to contact Rania's teacher to learn about Rania's behavior at kindergarten and inform her about our plans. Is this plan okay with you?
Sure, thanks very much.
You are welcome. See you next month.
Did Nurse Senna provide family psychoeducation? What important messages did she convey to the mother? Explained Rania's problem. Explained that Rania can learn new skills, and the carer's role is very important. Acknowledged the mother's concerns and frustrations. Explained the importance of positive rewards and discouraged harsh punishment. Praised the mother's efforts. Assessed the mother's own well-being and activated support from relatives.